Hello, Seagulls. It's Thursday, May 20th. We had some technical difficulties this morning during the live briefing, so I'm joining you from my office for this recorded version. Thank you for joining us. SU's monthly COVID-19 positivity rate remains below 1%. While the number of tests we conduct will decrease this summer as many students and others are off campus, we remain optimistic that our positivity rate will stay low. Since last August, we have conducted nearly 95,000 tests with fewer than 850 positive results. Now, because of our low positivity rate, coupled with the low number of individuals on campus as we begin summer operations, this is an optimal time to transition to our new COVID-19 protocols, which means testing will soon come to an end for vaccinated SU community members, at least through the end of 2021. As we make this transition, please be on the lookout for emails from COVID testing with updated information. Faculty, staff, and students who have been fully vaccinated against COVID-19 will receive an email once Campus Health has their vaccination information on file. At that time, they'll be asked to schedule a return test between June 1st and August 23rd for employees or August 29th for students. Once that test is completed, these individuals no longer need to continue testing to maintain campus access, at least through the end of 2021. This, of course, is assuming the virus continues its current course of declining infections locally and nationally. Those for whom SU does not have vaccination information on file also will be contacted by Campus Health with information on what to do if they've already been vaccinated, if they wish to request an exemption from vaccination, or if they don't intend to get vaccinated at all, despite our strong encouragement. Please remember that these vaccines are not only very safe, they are nearly 100% effective for preventing severe COVID disease, hospitalization, and death from all known variants at this time. That's great news, and I strongly encourage you to seek out authoritative sources of scientific information and make your own personal decision to protect yourself by getting vaccinated today if you haven't done so already. We will continue to conduct regular testing of a small number of fully vaccinated members of the campus community. If you would like to continue to test, even after you're fully vaccinated, you can email COVID testing. We will continue to monitor the case positivity and watch for new variants through this testing, as well as through the frequent testing of those who are not vaccinated on our campus. Like many of you, I've been closely following the new guidance issued by the state of Maryland and the Centers for Disease Control and Prevention regarding best practices for COVID-19 mitigation. I know some of it can be confusing, and for that reason, I'm going to go over exactly what our practices currently are at SU regarding face masks, testing, and other operations, and how we expect some of that to change this summer and this fall. Since Governor Hogan's announcement earlier this month that Maryland's face mask requirement would be lifted, we've received questions regarding when SU may end its requirement. The answer is that once a large enough percentage of our campus population and the population in the surrounding area has received the COVID-19 vaccine, SU can consider revising its face mask policy. This, along with other public health conditions, are constantly being reviewed by the university health team and local healthcare professionals in order to inform SU's policies. Although federal and state mandates regarding face masks have been lifted in many cases, SU will continue following guidance from the University System of Maryland in requiring appropriate face mask use in all campus buildings except when eating or drinking in a designated location, inside your residence hall room, or alone in your private office. Face masks are not required outdoors on campus unless appropriate physical distancing is not possible. This is especially important to remember, as most employees are scheduled to return to campus for work by July 6th. And speaking of our hardworking employees, I hope those who have not already done so will remember to complete the SU Return to Campus Questionnaire that you received from Human Resources in your SU email several weeks ago. The deadline for responses is tomorrow, May 21st. As most of you know, the University System of Maryland will require all SU students and employees to be fully vaccinated against COVID-19 prior to the fall semester. We have set a goal of July 6th for all SU community members to receive their first shot of one of the 2-dose vaccines or the only shot of the 1-dose vaccine. You are considered fully vaccinated 2 weeks after your final shot. The Wicomico County Health Department and Maryland Department of Health continue to offer mass vaccination clinics in Salisbury. No appointment is necessary for the Maryland Department of Health vaccination site at the Wicomico Youth and Civic Center. However, we know that access may be difficult for students and others who may not have reliable transportation. For that reason, we will continue to offer vaccination clinics on campus this summer in Mag's Gym. Please watch your emails for the dates of upcoming on-campus clinics. The most frequently asked question we've received in recent weeks is, will SU offer exemptions to the vaccine requirement? The short answer is yes. SU will follow federal and state law regarding exemptions for health and religious purposes in very specific circumstances. If you feel you qualify for an exemption, please send email to campushealth@salisbury.edu with the subject line exemption, and that office will guide you through the request process. Those who receive an exemption, as well as those who don't receive an exemption but choose not to be vaccinated, will be required to take an SU-administered COVID-19 test twice weekly this fall to maintain access to campus buildings, classrooms, and offices. Tests for those without exemptions will be every Tuesday and Thursday. We will be able to provide more flexibility in testing schedules for those who do receive exemptions. In addition, students and employees who do not receive the vaccine and do not qualify for an exemption will have additional restrictions as it relates to high-risk activities. Students who are unvaccinated and do not receive an exemption will not be permitted to live in multiple occupancy units. Single rooms will be provided for those students on a first-come, first-served basis. Another consideration for unvaccinated students and employees is that missing a COVID-19 test that results in your losing campus access will not constitute an excused absence from class or from work. More than 80% of SU's classes are expected to be held face-to-face this fall, and faculty are not required to provide accommodations for students who lose classroom access due to missed tests. Similarly, employees who miss work due to loss of campus access will be required to use leave time for those days. Frequent absences may result in disciplinary action. While these policies may seem strict, please know that our goal is not to be punitive, but rather to keep the campus safe. Science has shown us that the COVID-19 vaccine is the best tool that we have to help ensure that outcome. One more item of note is that our visitor policy has changed. COVID-19 screening can now be handled online. Visitors should complete an online screening on the day of their visit before coming to campus and may be required to show their clearance via their mobile device or on a printout once they arrive on campus. Of course, they will be required to abide by the same face mask and physical distancing policies as our campus community members. Certain offices and functions will maintain the option to screen visitors in person. In the past 2 weeks, members of my executive staff and I have hosted live town halls on COVID-19 for students, families, and employees. Thank you to those who joined us and submitted questions. If you missed the town halls, they are archived on the SU website. Last week, I also had the pleasure of interacting with many members of our class of 2021 and their families during our first SU grad walk at Seagull Stadium. It was so wonderful to be able to hold an in-person celebration for our graduates this spring, and it's certainly something I'll never forget. Let's take a look at some of the scenes from that event. Okay, at this time, I will respond to the questions that were sent in this morning. As always, when you have questions, send them to stayinformed@salisbury.edu. But here are the questions that were sent in for this morning's briefing. The first one is, if I'm fully vaccinated, can I cancel all of my upcoming pre-scheduled biweekly appointments? Yes. In fact, that's automatic. It will be done for you. The next question is, can I sign up for additional testing if I so choose? The answer to this question is yes also. So we have a limited capacity to continue testing even for people who are fully vaccinated. And if you want to do that, send an email to campushealth@salisbury.edu and we will try to make arrangements for you. The next question is the COVID vaccine required for graduate students, especially those who are hybrid students? And the answer is yes, the vaccine requirement is for everybody as a condition for maintaining access to campus. If you're a graduate student and you're coming to campus for only 1 day a week, send email to campushealth@salisbury.edu and we'll try to make arrangements for you to test on an appropriate day. The next question is, why aren't we continuing with indoor masking, testing, and remote work and de-densification practices that have kept campus relatively safe this entire year through at least the fall semester until all populations can be vaccinated? Well, as the prevalence of the virus declines and as the percentage of our campus community who's vaccinated rises, we are continuously more safe. And so for now, our indoor masking policy remains in place, and there will be an effort to de-densify some of our meeting spaces, although most of our classroom spaces are going to be operated at full density. We will monitor the prevalence of the virus, our positivity rate, and on campus and also in the community, and that may give us an opportunity to relax some of these restrictions even more. The next question is, how did we come to the decision to stop regular testing for those who are fully vaccinated? Well, the science tells us that people who are fully vaccinated have an extremely low probability of contracting the disease and an extremely low probability of transmitting the disease to others. And so this gives us an opportunity to relax some of the restrictions as we go into the fall semester. We will test those who are unvaccinated twice every week as a condition for coming to campus. And there will be a small number of people who are fully vaccinated but still want to test, at least occasionally. And that will give us an opportunity to continue to monitor the health of the campus and also maybe the appearance of some of the variants on campus. So that will help us to keep an eye on what's going on campus. So those are all of the questions that we got this morning. That wraps up our final live briefing of the spring. Over the summer, I'll bring you monthly recorded updates like this one as we count down to the fall. Until then, please stay safe and thank you for all you do to protect the flock.